doesn't change. Nurses' medical errors affecting factor trends. Nurses having children, smoking, caffeine, and alcohol consumption, using antidepressant, their love to nursing profession, and encounter cases with the medical error in daytime hours and night shift. According to age group nurses, differences were found between the subscales and average scores of medicine and transfusion practicing hospital infections during the day shift. According to units of nurses, the differences between subscales and average scores of tending to medical errors, applying medicine and practicing transfusion, hospital infection, patient follow-up, and material safety, and FAS have been found significant. Differences of average scores of communication were not found. According to the education level of nurses who participate in study, the difference between the day shift and night shift medical errors tendency related to scale mean scores of the subscales were not found significant. Relation between medical errors tendency and stable anxiety scores of nurses. A negative directed weak relationship has been determined between average of medical and transfusion applications and hospital infections in daytime shift, anxiety, and medical error tendency. A positive directed weak relationship has been determined throughout the averages of FAS and communication in the night shift, anxiety, and medical error tendency in spearman correlation analysis. Result and suggestion. Consequently, the state anxiety rate has been determined as 100% among our nurses who are located in an important station for health practice in our country. And this anxiety increases their medical error tendency. The medical error tendency and anxiety of nurses have been determined to be various during day shift and night shift. In this context, organizing social activities for reducing anxiety levels, quality training programs should be organized to prevent medical errors, and instead of punishments, rewarding should be applied to those who inform the manager about medical errors. Thus, level of medical errors can be determined properly. Nurses' working hours should be regulated so as not to increase anxiety and the tendency to medical errors. Thank you.
It's a most interesting. Hello. It's a most interesting subject, which is a bit on my area. I don't know if you want to publish this, but if you want to publish this, you should certainly do a regression analysis to see what are the factors that may explain. And I noticed that you do a lot of tests. You do many tests. And in this case, a P level of 0.5 is not good. You should have a more stringent pay level. And finally, I noticed that you have some nurses who were depressive. It's pity that you didn't have a depression scale, but now you can't do anything. But I certainly suggest that you do a regression analysis to sort out what are the factors that are important, because in a correlation, you don't show in reality anything, because you correlate 2 factors or 3 factors, and there may be a factor that you don't know of. Anyway, it was a good work. Any questions? No questions?
Thank you.
Don't be shy. Okay.
Thank you.